Hello, and welcome to the second in a series of health equity forums sponsored by UMass Memorial Healthcare. I'm Melissa Hanson, a reporter with MassLive here in Worcester, and I'll be your moderator for today. Where are we in the cycle of this pandemic? On March 1st, 2020, nearly a year ago, UMass Memorial activated its command center as it became apparent that the coronavirus was coming to central Massachusetts and its hospitals. Since then, the healthcare system has treated nearly 20,000 COVID-19 patients, has stood up a field hospital twice, and has seen more than 1,000 of its caregivers test positive with the virus. Locally, the pandemic has put a spotlight on healthcare disparity across racial, ethnic, and economic lines. Nationally, the Latino and African American communities have been disproportionately impacted. Here in Worcester County, Latino residents have represented more than a third of all COVID-19 cases, while being only 13% of the population. In response to these numbers and to the overall disparity, UMass Memorial has partnered with the City of Worcester to form a health equity task force. The healthcare system has also been out in the communities providing educational materials, masks, and testing. Over the past few weeks, UMass Memorial has established a mobile vaccination program to provide vaccine doses to patients who are homebound and unable to travel to mass vaccination sites, as well as an equity enhancement program to address health disparities. Our panel today has leaders from UMass Memorial and from the community to give you an update on these efforts and to give you information about getting the vaccine. I would like to introduce our forum panelists and give them an opportunity for some opening remarks. First, I would like to introduce Dr. Eric Dickson, the President and CEO of UMass Memorial Healthcare. Dr. Dickson, can you tell us how the rollout of the vaccination program has been going so far from your perspective?
Great. Well, thank you everyone for being here today, and thank you, Melissa, for hosting. I think the vaccine rollout program has been bumpy here in the state of Massachusetts. We all should acknowledge that, especially early on. I think that the state has rebounded from that and now has numbers that are almost in the top 10 in the country for getting vaccine into arms and the per capita rate of being vaccinated. But I think there's still a major equity issue in relationship to the vaccine program. The move to max vaccination sites has helped us get more vaccine into arms. And on its surface, everybody has equal access to the mass vac sites. Everybody can go online and regardless of the color of their skin and sign up. But the reality is, if you dig a little deeper, not all people have the same access to a ride to Gillette Stadium. Not all people have the support structure needed to get you to Gillette Stadium if you're in a walker. Not all people are comfortable leaving their neighborhood where they feel safe, going to a very foreign environment. Not all people have the same access to internet and computers. And if you look specifically in the neighborhoods of color and populations of people of color, they have less access to the things that you need to get to a max vaccination site. And you know, our push to the governor, and he is listening, is that you need to balance the speed with equity. And you can't just say, well, everybody has equal access to Gillette Stadium or any other max vac site and computers, and that's fair. Because you've got centuries of structural racism that have created a situation for a group of people that they don't have equal access to the things that they need to be able to get to one of those sites. Even having an age cutoff of 75 means that you're going to see a larger proportion of Caucasians than persons of color get vaccinated. And specifically, Black men have the lowest life expectancy in the country in terms of a population. And that means that you're not going to see a lot of Black men over 75. So if you use that strict age cutoff, that in itself is creating an inequity. And it's often good people doing what they feel is the right thing and what they feel is equal, and everybody has equal access. But you have to take a pause, an equity pause, and think, okay, for people of color, is this really equal access? And the answer in the current vaccine program is no. So we saw this with the testing, we're seeing this with the vaccination, And Maggie and her team have gone out and the testing and had to go into the neighborhoods where people live to test in order to get the people of color tested. And we have to do the same thing with the vaccination program. And she's doing that right now with her mobile vaccine equity enhancement program. Is it enough to equal the playing field in some way? No, it takes a lot more than that. But it is a start and it is better. And that's really been our focus moving through this pandemic, to take that pause, to think, how, is this truly an equitable system, what we're doing, whether it be in treatment, testing, or vaccination. And when you do take that pause, you'll find that most of what we've done in medicine, there's always some way we can do it better from an equity perspective.
All right. Thank you, Dr. Dickson. Our next panelist is Maggie Rodriguez, a community health worker and a patient navigator for the mobile vaccine program that Dr. Dickson just mentioned. Maggie, you're on the front lines of making sure that members of the Latino and Black communities in particular understand the importance of getting the vaccine and getting them access through the mobile vaccine program. Can you tell us how people in the community are reacting to the mobile program so far?
So yesterday we had a mobile vaccination program at the Boys and Girls Club. And while I was there, I asked patients like how they liked what was going on, and they were impressed with the operation, and they were very happy because they have difficulties. They've been having difficulties in getting vaccinated due to many issues, transportation issues, health issues, social economic, and even computer skills to get, to sign up on a vaccine site. They were very happy that we're doing this, very satisfied. There wasn't words that they could say to express how they were feeling that day. And my part of the vaccination program is to actually reach out to these 65 and older patients. We do it through different axes. Some of them, me and Catalina Delaney, which is another community health worker, for the Boys and Girls Club, we were able to do calls. So we did outgoing calls to all these patients to get them to the Boys and Girls Club. 6 out of those 40 that we were able to book were mobile vaccination people. So these people were scheduled with our mobile vaccination team, which drove to the patient's house, administered the vaccine right in the patient's home, right around the 016, 01610, 01609 area code. So the patients are loving this program.
Great. Thank you, Maggie. Our next panelist is Dr. Mark Johnson, the chair of neurosurgery at UMass Memorial Medical Center. Dr. Johnson, you've recently participated in a public service announcement sponsored by the Massachusetts Department of Public Health that talks about the safety of the vaccine. What is the main message you want to get across to those who may not trust the vaccine, particularly in communities of color?
I think the main message that I'd like to convey to our listeners is that these vaccines were developed using technologies that were put into place long before the pandemic began. They went through the same rigorous testing that all vaccines go through, and they've been shown to be safe and effective in tens of millions of people. Right now, the United States is administering about 1 million doses a day, and the number of deaths associated with these administration of these vaccines is near zero, right? In addition, the vaccines have been shown to be very, very effective in preventing severe disease from the coronavirus. So the number of hospitalizations, the number of deaths in people who have been vaccinated is exceedingly low. One of the great tragedies of this pandemic is that during the first wave, we saw a lot of inequity in terms of who was being affected, who was being sickened by it, and who was dying. The elderly, vulnerable, the poor, ethnic minorities. And now we're seeing some inequities in administration of the virus. A lot of that has to do with the things that Dr. Dickson talked about, limitations in access, in transportation, in computer skills at home and so on. Some of that also has to do with fear, distrust of the healthcare system, trying to deal with a disease that disproportionately affects the people who are most fearful. So I think it's very, very important that doctors communicate with their patients about the efficacy and the safety of this vaccine so that they can be vaccinated and enjoy better health.
Thank you, Dr. Johnson. Our next panelist is Stacey Luster, who is the General Counsel and Assistant to the President at Worcester State University, and also the co-founder of Black Families Together. Ms. Luster is joining us by Zoom and is representing the community on our panel today. Ms. Luster, I'm wondering what you're hearing from the community in respect to the rollout of the vaccine, and I understand that Black Families Together has hosted a series of public forums on this topic, so we would love to hear your perspective.
Thank you very much. We're hearing multiple points of view. The fear of the vaccine is real, but I believe that I'm glad to see the title of this presentation called Changing the Conversation, because I think it's time to change the conversation. Yes, the fear is real, and there are people that do not trust the system because of the years of oppression and racial experimentation. Those fears are founded in history. However, the majority of the people that we are talking with, they can't get access. They want the vaccine. They play the computer game and they get nowhere. They don't have a way to get to these mass vaccination sites. They want access. And so I think that it's important for us to focus on getting access into the community versus focusing on the fear. I think that the more Black and brown people in the community actually receive the vaccination, the less fear there will be. I love hearing Dr. Dickson. I always love hearing Dr. Dickson talk. And when he talks about the equity lens, the fact of the matter is that Black and brown folks have a shorter life expectancy. And I really didn't put the one and one together. I've been devastated ever since I found out that now, instead of living 10 years less than white women, I now live, I believe, 11 or 12 years less than white women. This virus, in conjunction with the overall health disparities, has the potential of causing irreparable harm. And I believe that we cannot allow that to stand. And I'm all in with your point of view, Dr. Dickson. Let's do what's equitable. And equitable means you don't give everybody the same thing. You give everyone what they need. And Black and brown communities need increased access.
Thank you, Stacey, and all of our panelists for your opening remarks. Now we will have some questions for our panelists. Viewers can submit questions via the Facebook comment section, and we will do our best to have them answered. So starting off, there's been a big focus on vaccine rollout here in Massachusetts. For example, there's been a limited quantity of vaccine so far, and last week the vaccine appointment website crashed as thousands of new appointments became available. Are our panelists comfortable that those challenges are being overcome and that the state is on the right track? Maybe Dr. Dickson, would you like to start?
I'm comfortable that the state is on the right track, but I think first you have to acknowledge that there's been mistakes made, there's been problems with the vaccine rollout. Some of those fall on issues at the state level. Some of them even fall upon us in healthcare and the way we did the initial rollout. I'm comfortable that we're on the right track, but worried that in our haste to get as many people vaccinated as possible, some will be left behind. Because the most efficient way to get the most vaccine into arms is not the most equitable way. And there just needs to be a balance between those two things. And I don't think there's been enough education in terms of non-English speaking patients. We get a lot of non-English speaking employees at UMass Memorial Healthcare. And even in our own healthcare system where we've pushed to vaccinate everyone, we see populations that don't understand the vaccine, are worried, don't have the trust, and have a firm basis for not trusting medicine, and because of the history of medicine. And so I think I'm cautiously optimistic, but we have to do more to assure that we get to the most vulnerable populations amongst us, especially those living in poverty, because this fire that is this pandemic started in the elderly and was greatly impacted in the, if I can use the term, neighborhoods of color or under-resourced neighborhoods. And you're not putting it out until you get those populations vaccinated. It will continue to smolder and restart over and over again if we have a vaccination program that doesn't get to those populations. So I'm cautiously optimistic, but I think we need to do more in this space.
And if I could just follow up on what Dr. Dickson was saying, I think the state is on a good path, but I also think there's at least another layer that needs to be added on top of that, and that is the layer of geography. Right, so if you look at positivity rates for the coronavirus in the state of Massachusetts and around the country, it's actually not evenly distributed. And there are hotspots, certainly hotspots within the city of Worcester, many of them in the poorest communities, in communities of color. And those are communities where there may be limitations to transportation and to computers and so on. I think the mobile vaccination program is an outstanding program to try to combat that. I know that the medical school has a vaccine volunteer corps where they're actually talking about going door to door to administer the vaccine. I think the state needs to put more emphasis on that to try to deal with the areas where the coronavirus is most endemic and where people are most likely to be infected and affected.
I think if we do go door to door, they have to see somebody they trust, right? When in the sense of when I go out with the community benefits team, the Care Mobile, and Maggie's team, they see me. They don't know me, but they know Maggie, and they know that entire team. And if not for them, I don't think they would have come to our testing sites. And you don't earn that trust during the pandemic. You've built that up over years. And so you can't think you're going to rush into this space all of a sudden after you've ignored it for decades, and suddenly, oh, now we're going to do this and it's going to correct all the ills of all these years. You have to put the energy and effort into it like Maggie and her team do all day, every day, and in order to have that. So when something like this happens, they have a trusting relationship with the team, they know, and you can use that relationship to try to create a more equitable system.
So far, are you seeing the kind of participation from underserved populations that you expected? And if not, have you identified any underlying issues or barriers?
So I'd say, what would you expect after given what we know about healthcare and equity, that Black women are less likely to get mammograms than white women, Caucasian women. Black children are less likely to get their immunizations and their well child visit every year than Caucasian children. I can just sit here and go through data point after data point of health maintenance and say that there's always a gap in almost every metric we look at. And so if you said to me, Eric, do you expect that you're going to roll out a program and that program is going to be equal in terms of the percentage of persons of color in the population and the percentage of persons getting the vaccine? I would have to say you'd be completely naive to believe you're going to correct hundreds of years of people being discriminated against and loss of trust with any program that you're going to roll out. So I would say, are we getting what we expected? Yes, but unfortunately what we expect is a gap between persons of color getting the vaccine, and that's especially true in terms of African American populations, who we should just all recognize have been discriminated against more than any other population. And in our own employees or in our communities than in Caucasian populations. You know, we're doing really good work, we're trying, but I would be shocked if somehow we ever could get to a program where there was true equity in terms of the percent getting the vaccine of those populations. And it's disappointing that we have to acknowledge that, but if we don't acknowledge that that's the case in medicine today and has been the case for a long time, we're going to get through this COVID thing and we're going to go back to the way it was, and we're going to forget about this issue, and we're going to continue to have gaps in care between Caucasians and African Americans. And I think that shining a light on it and what we're doing today will hopefully help, but more important than just getting through this pandemic, it's just we have to have this lens on every day and every decision that we make about healthcare. And if we don't, there'll be another pandemic or there'll be another disaster that occurs, and we'll try to rush in and think we're going to solve this problem then, and you're not. So, you know, we've got to work beyond the pandemic to create those trusting relationships so that when the next thing arises, and there's always the next thing in medicine, we'll be more prepared to deal with this.
Yeah. You know, I was looking at, oh, go ahead.
If I could just add something in on that point, you know, I'm still, it's still resonating with me, the connecting of the dots that Dr. Dickson did in terms of the first two phases, the first two groups of people to have access to the vaccine, the 75 plus, which in general, Black people don't live to be 75 plus. And then the 65 plus, still fewer of us live to be 65 plus. And so by, I won't say intentionally, but by design, Black people are ineligible for the first two rounds. And I'm going to say Black and brown. I just happen to have the data on Black, but I'm pretty sure it's similar for brown people as well. And so something needs to be done now, structurally, to ensure that Black and brown citizens have an equal access in these early phases to the vaccine, consistent with the population. We have the demographic data. You know, UMass State Data Center can tell you. And so what age do you need to go to in order to get the representation percentage-wise of the population to gain access to these first two waves of vaccine? That needs to be done yesterday. It's very difficult for those of us who consider ourselves to be influencers to encourage people to get the vaccine when we haven't gotten the vaccine. So the people who are out there, you know, saying, get the vaccine, we haven't gotten the vaccine because it's not our turn yet. I have no idea when it'll be our turn. But what we need to make sure is that proportionately, there is access based upon the life expectancy of Black and brown people in each phase, because right now we're just very rarely represented in these phases.
You know, I would echo those comments. We have to remember that as the vaccine is being rolled out, the pandemic continues to march on as well. I was looking at data from the CDC this morning, actually, and if you look at the number of vaccine doses that have been administered here in the United States, it was about 66 million as of last week. And if you break that down by race and ethnicity, about 10% of the white population has been vaccinated. It's about 3.5% for the Latino population and about 4.5% for the Black population. So there's a huge gap there. And we have to just remember that those delays in vaccination, which are not intentional, I don't believe, but are nevertheless very real, can be measured in hospitalizations and lives. All right, so I think it's very important for our leaders in government and healthcare to recognize this disparity as it is developing, as we see it coming over the horizon, and take measures to deal with that.
Ms. Lester, Black Families Together has been really visible on this issue. What has been your messaging to your targeted audiences, and are you getting the support and services from outside agencies to help make the desired impact?
Well, first of all, we've been working with UMass. I met some of these folks because of the vaccine, because UMass has been working with us and St. Vincent's has been working with us to get the word out. And our message is to the communities to understand the facts, understand your own health situations, and make informed decisions. And we say that with confidence because when you do that, it is obvious that you should get the vaccine. You know, it's always obvious that you should get the vaccine. And so our message is to get the vaccine. The problem where the system is not ready to support us is once we convince the people to get the vaccine, they can't get it. Mm-hmm. So that's where the system is failing the community, is that those who want it cannot get it. And so that's everybody's concern, right? But because Black and brown people are so underrepresented by age because we don't live as long, it's really important for that data to be re-examined so that we can gain access as soon as possible.
Great. Ms. Rodriguez, how is the community responding to your efforts in their neighborhoods? Are people receptive to your messaging, and are they heeding medical advice?
So they are receptive to getting the vaccine. We've been doing outgoing calls to the people in the community. So say right now we are doing a vaccination program at Joan of Arc Church. So we get our community leaders to help us use their locations, and actually they help us assist in obtaining individuals that are 65 and older to be able to go to these vaccination sites to get vaccinated. Me and Catalina have been doing outgoing calls, and there has been many elderly people who are scared. They don't want the vaccine. And me and Catalina have educated them on what is expected and what the importance of getting the COVID vaccine. So, and kind of turned them around to be able to get it. So it's been a process in convincing the elderly to get vaccines. They're not too prone to it. I had a situation actually yesterday that a gentleman I had booked him the appointment. He did not believe that this program was in place. He called the Boys and Girls Club. They told them no, and then he didn't show up. So we called them from the Boys and Girls Club, and I called them specifically, and I said, William, why aren't you here? He's like, no, you're a hoax. They told me you're a hoax. So it's hard to convince these people that we are out there to vaccinate them. But we're getting them in, and they're very happy with the results.
Great. Dr. Johnson, you are part of a statewide PSA campaign to encourage vaccination compliancy and participation. Do you see doctors playing a major role in helping to make the public more comfortable with the whole process?
I do. You know, the relationship between patient and their doctor is a special relationship. Where else would you meet someone for the first time, tell them all the secrets of your life, expose your body to them, and then take their advice, perhaps even advice to open you up and swap out your heart or operate on your brain? It's a very, very special relationship, and one that doctors hold very dear. This is a worldwide health crisis. And I think for many of us as physicians, we feel this is what we were born for, to take care of the people around us. This is why we trained. This is why we went to school all those years. And I think it's important for doctors to understand that their word carries weight with their patients. And it's important for us to convey the importance of social distancing and of vaccination, as a way of preserving their lives and the lives of their loved ones.
Though vaccinations have started, the virus is still spreading. Dr. Dickson, are you concerned about the UK and South African variants of the virus?
Very concerned about mutations in the variants that are coming through. We test for the UK variant, which is more infectious than the standard American variant that we have here. And right now, 1 out of 2,000 of the tests that we do has the UK variant. And because it's more infectious, that number will go up. Just mathematically, it's more infectious, it'll spread more, it'll go up over time. And it's truly, as Mike Hirsch, my friend, said, it's an arms race. It's about getting vaccine into the arms. And if we can get vaccine into the arms, we will prevent that variant and the South African variant from getting a toehold here in the United States. But if we're slow to do that, or we leave neighborhoods out where the virus can get in because they haven't been vaccinated, then you're going to see opportunity for a variant to mutate again and again, and could ultimately end up with a variant that is resistant to the vaccine, such that all your work to get the vaccination program out and to get people vaccinated, you'll be starting from ground zero. So it's not likely that that's going to be the case, but we can reduce the likelihood by getting everyone vaccinated, and that means everyone, as soon as possible.
What are the plans to expand the mobile vaccination program? How many more doses would UMass Memorial need to acquire to do so? And I did see one of our online commenters is wondering about this as well, specific to the Fitchburg and Leominster communities and also homebound patients.
So right now we're in a time of vaccine shortage, and the state has cut back the vaccines that we receive. So we've been pretty limited in our ability to expand the mobile program. We did go into Clinton the other day. Maggie and I were there, and we're doing in-home vaccinations, and Fitchburg and Leominster are certainly on the list. But one mobile program covering 1.2 million people in central Massachusetts isn't going to be enough. We need to have dedicated vaccine available for the mobile programs and for the in-home programs that we know is consistently going to arrive, so that we can build out a larger program. And we just haven't had the commitment on the vaccine yet. So we're all eager to do more. UMass Medical School has got a vaccine corps of students all eager to go and to help us. Got to work with a couple of those students the other day that just give me great hope for the future of medicine. But if we don't get vaccine for special programs like that, and it all goes to the MaxVac sites, then we'll continue to see the gap that Mark's talking about, right? 2 and 3-fold difference in vaccinations of Black and brown people versus white people. And we just can't accept that. We just can't accept that.
Aside from the mobile vaccination program, what other equity initiatives is UMass Memorial working on?
Well, right now we've got a major one relative to well-child visits for Latinx and African American children, to try to close the gap that exists between children getting their appropriate care and versus that of Caucasian children. And it's been an incredible learning experience, especially during a pandemic, because you say, well, of course they all have equal access to appointments with their primary care with their pediatrician. But if you have food security and you have job security and you have housing security, and it's easy for you to take a day off from work so that you can bring your kids in to see the pediatrician, yeah, obviously that's you're going to bring your kid in for their well-child visit. But if you have food insecurity or job insecurity or transportation issues, or if you're working 2 jobs at minimum wage to support your family, I can't imagine how in that situation you can take the time off necessary to bring your child in to get their well-child visit. So, what we're learning is it's the same lesson over and over again. What appears equal on the surface is unequitable when you dig down deeper. And so now we are working on transportation for the families so they can get their well child visits, work issues, so mothers, if necessary, or fathers can get time off to bring the kids in. And it's this whole set of issues that you don't think about. I've never had to think about in terms of getting my child in for their well child visits. But if you're going to close that gap, you have to start thinking about those issues. And some of the care mobile going out and doing, neighborhoods and schools, dental care be another big issue. Right? And if all of those other things are secure in your life, of course you're going to go get your teeth cleaned. But when they're not, that's going to take a back seat to trying to ensure that you have food on the table or that you maintain your employment. So if we're going to get to a more equitable system, we've just got to dig in and we've got to figure out what the barriers are to people getting care, and we have to address them because there can be no quality of care without equity.
Ms. Luster, what has the feedback been like after Black Families Together forums? I know you said earlier that people do want this vaccine, but the access is still an issue.
Yes, the access is still an issue. And, not everyone, wants the vaccine. Some people want to wait and see. But the wait and see is taking too long because, as was stated again and again, Black and brown people don't live as long as white people. And so we are underrepresented in these first phases. And so the metric has to be changed to give us access. It definitely has to be changed. But I really want to go back to, those trusted primary care physicians. That's the first person I called. I called to find out from my primary care physician who took the time to call me back. I didn't want to talk to a physician assistant. I didn't want to talk to an office manager. She took the time to call me back, looked at my chart, looked at the medications that I take, and determined whether or not there were any risk from the vaccines, and then told me, as soon as you can get it, because if you get sick, it could be serious. But that you are at no risk for your health based upon your health conditions. And it should be noted that I specifically picked my primary care physician because she is African American and educated at a top medical school in the United States. And I believed that, unlike my previous primary care physician, that she would possibly know about one of my particular conditions that is more prominent in Black people. It's in the sickle cell family. And sure enough, she did. And she understands me, she understands my health. And so one other equity initiative that needs to be promoted is to diversify the people who are going into healthcare. We need more Black and brown primary care physicians. Let me tell you, it was not easy to find this particular doctor. In fact, I go to Sutton to see her. So that is really important, that people see people who understand their own physical situation by lived experiences. And so I encourage and would love to help in anything I can do to encourage there to be a stronger and faster pipeline for Black and brown people into the health fields.
One of our online viewers is noting that seniors are struggling to get the vaccine and is wondering if there might be more programs available in senior centers or communities.
So right now, what we are doing is we're teaming up with our community leaders, let it be food pantries, Boys and Girls Club churches, anywhere out, and senior housing, to be able to link with them and actually they help us with their facilities, so we're able to go to that site wherever the elderly are, and to be able to give them their vaccination. But also these community leaders are helping and assisting in pinpointing which patients are 65 and older to be able to, especially in the Black and Hispanic communities, to be able to get them in and get them to our sites to get vaccinated.
And if I could piggyback on that, that is such a critical point. The last COVID map that I looked at for Worcester showed the Lincoln Village area and the Union Hill neighborhood as being hotspots. There is a senior housing development where hundreds of seniors live. And, we need to go there to their community center and vaccinate folks. So you have a high proportion of Black and brown people there. And there's also a senior living situation in the Union Hill area. But we know that unfortunately our schools have not been open. So there are public buildings that we can use in every neighborhood. That's one of the benefits of living in Worcester. There are schools in every neighborhood and they have not been open. And so there should be opportunities. Where there's a will, there's a way, and we can do better.
All right. Another viewer online is wondering if residents will have to get the shot every year or if it's just a one-time thing.
We don't know the answer to that. My wife and I participated in the Pfizer vaccine trial, so I got the vaccine in August, and she got the placebo shot. So there was a little vaccine envy in my house for a while. But they are going to follow participants in the trial over time and look to see if the immunity wanes, and if that starts to disappear, people in the trial will then be asked to get a booster and check to see how often that has to be. So the clinical trials, should remind folks, this is an emergency use authorization of these vaccines, are not fully approved yet. The clinical trials continue on, and I think that we'll get some information on that probably this summer. We'll start to see the people that were first vaccinated a year ago and monitor their antibodies and whether or not they get infected and see if a booster is required. The other reason you might need to get a booster, if there were mutations that created a variant strain that was no longer resistant, that is resistant to the vaccine, it's pretty easy with the Pfizer and Moderna to just change out what's called the mRNA inside the vaccine such that it would make you not be susceptible to those strains. So the easy answer is, I don't know, nobody knows, but we do have good science going on at UMass Medical School that will answer that question.
Great. Stacey, one of our online viewers is wondering what people in the community can do to help shine a light on the access issues that you've spoken about.
That's a great question. I wish I had the correct answers, but we need to use the public process, and I think we have good representatives in the state legislative delegation, and I would reach out to them, and I would contact the governor's office, and I actually have done those things. And the more of us who do that, the better, to say, look at the proportion of Black and brown people in these demographics. And if the numbers are not there, change the plan. I see that has been done in Boston, where they have allocated certain amounts of vaccine for communities, irrespective of those demographics. We need that in Worcester. Worcester's the second largest city in New England. And I think we're often overlooked, as though we don't have that same demographic disparities. We do, we have these disparities. And so we need the same flexibility that was provided in Boston to be provided in Worcester.
Maggie, do you have anything to add there? Is there anything the community could do to help you with your efforts spreading the word to people in the community?
Definitely, and reach out to us if you're interested in getting your elderly citizens vaccinated. Reach out, and then we could see how we can join together to use the mobile vaccination program and get them vaccinated. That's all I really have to say.
Yeah, I would say, as I hear and I learn from Dr. Johnson and Stacey about the numbers, and I hear Mark clearly tell us there's a gap, a 2- and 3-fold difference between Caucasian and African Americans getting vaccinated and Latinx populations. And then Stacey say, we tell people get vaccinated, and they say, I can't, where? That if you want to close that gap, there's a pretty easy solution. You say that if you are a person of color, regardless of your age, you're eligible for the vaccine. And that, in our database, in our electronic health record, we ask for ethnicity questions, and it would be easy enough for us to just turn on and invite people. Right now it's based on age and risk factors, but it could be based on ethnicity. And I think there'd be some people that say that's unfair. We've had an unfair system for a long time that is discriminated against people of color, and I think it's probably time for us to do something different in this state, and I'd participate in that in a second as the CEO of UMass Memorial. But it's going to be disheartening if you keep on trying to educate people of color to get the vaccine, and then you keep on saying, no, you can't get the vaccine. You might make things worse in that situation. So I think what we should all be calling for is that we got to close the gap. And in order to close that gap, that means no age limit on persons of color to get vaccinated.
And I would say also, it's important to recognize that we do have allies, both in healthcare, leaders in healthcare, community activists. We have the advantage of data from the CDC. In fact, the new head of the CDC is actually from Massachusetts.
Yeah.
So, I think that the key is for us to speak with one voice as we see these disparities, not to remain silent, not to accept it as a fait accompli, but to say, we need to make a change, and then speak to our leaders and ask them to institute those changes in policy so that we can address these inequities and make certain that people who are at greatest risk of infection and hospitalization and death receive the vaccination.
Another online viewer is wondering if, in addition to the mobile vaccine vans, if there is a local number for the older population to call and find out where and when the van can get to them.
Yeah, I think with the van, the Mobile Vaccine Equity Enhancement Program, they're scheduled out quite a bit already. And what we depend on is working with the community beforehand, so you just don't show up and people are prepared that we're coming. There is a state call center now, which will give elderly folks that are currently eligible their options. But I don't think we have a program that's robust enough for us to be able to answer that question for most of the people that call. Unfortunately, most of the people that would call us and say, when is the van coming, would get the answer is it's not scheduled anytime in the near future. Because it's one program, and we go out and we do a couple hundred vaccines in a whole day's worth of work, and we've got tens and thousands of vaccines in vulnerable populations that we need to get to and to help, especially the elderly.
We have a question coming in for Maggie.
I worry that there's somebody on the phone that's trying to get the vaccine and can't get the vaccine. So I'm not sure if we can help, but blackfamiliestegether.com, shoot us an email and we'll try to see what we can do. I don't want one person who wants the vaccine not to get it. blackfamiliestegether.com.
Great. We have a question coming in for Maggie. This person says that their mother is afraid to get the vaccine. What should they tell her?
It's hard to educate an elderly person when they're set in their ways. I mean, soft-spokenness, kindness, but there was one lady that I was talking to the other day that she said, yes, somebody told me that, oh, it's better to just there's two options, or get the vaccine or die. And I was like, no, I don't want you saying that. It's important to get that vaccine. This will prevent them from getting illnesses. This will prevent them from maybe getting COVID. And just letting them know that not only is it important, but also the daughter should say, yeah, I'll get the vaccine with you, Mom or Dad. So you could see that it is important for us to take care of each other.
If I could add to that, if if the daughter wants to get it, if she's not the right age, she can't get it.
I
right?
know.
And so that can be a problem. But my granddaughter made a comment. She was saying, of course I want the vaccine because I want to go out with my friends. And so the elderly, they often say because they want to see their family and they want to see their grandkids and hug them and kiss them. And so it's so that they can enjoy what they should be enjoying at this stage of life. And everyone's at a different stage of life, but we all miss it. We all miss those just basic things. And so it's so that we can have the freedom of our lives back. That's why you want the vaccine.
I was in a similar situation. Most of us who are doctors, you realize that you're a doctor to your whole family and all your friends, regardless of what their medical problem may be. They will ask you for advice. And my own mother had that question about getting the vaccine. At first I told her that I had gotten it and I would recommend it, but I also tried to compare and contrast what happens when you get coronavirus versus what happens when you get the vaccine. I mean, there's no comparison, really, right? I mean, the death toll in the United States from coronavirus and around the world is, hundreds of thousands to millions. The death toll from the coronavirus, I don't know when this died. I'm sure that maybe there's one or two, but out of many, many, many millions. So I think sometimes just looking at it at face value, these fears are grounded in many things. And for many years, there has been an anti-vaccination movement, which has been on the internet and on television and elsewhere, I think, which has spread a distrust of vaccines in general. The other thing I said to my mom is, I think all of us have gotten vaccines. I couldn't even work if I didn't get vaccinated. I have to get hepatitis B and varicella and et cetera. And how many of us know people who have died or been horribly injured by a vaccine that they got as a child? I don't know any personally. I'm sure there's some out there, but I don't know any. And that argument, I think, was persuasive.
All right. Another viewer is wondering what efforts have been made to strengthen health equity for people who lack English proficiency.
It's a big challenge, and I appreciate them bringing it up. We have an employee resource group, which is made up largely of our interpretive services, and we have used that group to learn about our patients, our non-English speaking patients, and the challenges they face, and how we can do a better job. And it's actually been fascinating to work with them because I use interpretive services all the time when I practice medicine. I know Mark does as well. And we've expanded our ability to get interpreters, which is wonderful, through the virtual environment. And one of the stories that they told is that, yes, you can get an interpreter very quickly. All they have to do is show the patient the flags of all the nations in the world, and they pick the one that matches the nation that they're from and the language that they speak, and an interpreter comes up on the line. But what the interpreters told us, that you have to understand that a Spanish interpreter might be from Puerto Rico talking to somebody from Guatemala, or Ecuador, or Brazil. These are totally different cultures. And that, one of the things that we have to do is we go to more virtual interpreters, which allows us better access to interpreter services and better care for our non-English speaking patients, is that you have to give the interpreter time to connect culturally with that person. And they just, you're Spanish speaking. It's like assuming that two people that speak English are from the same place, right? And you could be from Australia or in America or England and have very different perspectives. So I think, we're using that group to help us understand how we can do a better job to be more sensitive to the needs of non-English speaking patients, and really drill down into the more of the individual areas and cultures that is a part of interpretation that I've never even thought about that before. And in the Spanish example, culture can be totally different in Guatemala than it is in Mexico, for example. And that interpreter has to bridge not just the language gap, but the cultural gap that exists between a physician and the interpreter. So I think good work going on in the space, but a lot still needs to be done.
Another viewer wanted a chance to thank Dr. Dickson for your commitment and for being present.
I would just say that of all the things that I've got to do with medicine over my career, this work is some of the most exciting. And learning not only about the inequities that exist, but how to address them. And you know, the more you know, the less you learn. I came to this in the last year or two pleading almost complete ignorance of, and I've been blessed to have people like Mark and Maggie and Stacey and others teach me such that I can do a better job as CEO for all of our patients and all of our caregivers. So I feel very blessed to have folks like Mark and Maggie on the team.
Great. I think one thing that's on everyone's mind is, you know, what will it take to get back to some kind of semblance of normal life? So what can people, you know, expect, and how long might that wait be?
I am probably over-optimistic, but I think between acquired immunity through getting infected and the vaccine rollout as it is here, we're going to reach a point of herd immunity, and you know, by the July timeframe. I think that's hopefully, I don't know that we'll be able to take off the mask all the time, but we'll be able to do a lot more. And Stacey said it, all the things we've missed this past year that we love so much. Hopefully we'll all remember this time and recognize just how fickle life is and treasure every moment moving forward.
Yeah, you know, that is a topic of hot debate. A lot of the national medical societies, they have meetings every year where everybody comes to a meeting. And all the meetings were postponed last year. And this year they're trying to put those meetings together and convince people to come. Right? So we have to determine, is that safe or not safe? I think the hope has been, and maybe continues to be, that this will go away completely. But a different view of the future is that it will be with us, but it will be tolerable. We will have some immunity so that if we get coronavirus, it doesn't make us have to go to the hospital, or we won't die. It may become more like the flu, in which case we may stop wearing the mask because we're not so worried about the devastating effects of coronavirus. I suspect we'll go through at least a transition phase like that. Hopefully we'll get to a day when we don't have to worry about it anymore.
On that note, COVID numbers are going down recently on a downward trend. Do you think the rollout of the vaccine is having any impact there?
Absolutely. You know, we had at the time 300 of our caregivers out with COVID at one time, and that number has gone to nearly zero. The first population to get vaccinated was healthcare workers, especially COVID-facing healthcare workers. We had a major issue in terms of staffing our ICUs and elsewhere, and that has almost been eliminated because we vaccinated our caregivers, and that's going to roll out to the rest of the population. And so we know it works. The vaccine works. We've seen it in the population of the people that work for UMass Memorial, and I think it's starting to have a real impact on the number of cases in the state.
Great. And one more question for me. What are some lessons from this pandemic so far that will help impact equity moving forward?
Could you repeat the question, please?
Oh.
What are some
Sorry,
lessons?
Maggie.
That's okay.
What are some lessons from this pandemic so far that will help impact equity moving forward?
Lessons. Change. We have to be able to change with everything that's been going on, like, and be able to work with each other to be able to make the change for all these people that have health equities. It's really hard for me to say what changes might be needed, but what we've been doing in the community with the mobile vaccination program, with the Stop the Spread program, reaching out to all these elderly patients, reaching, getting patients to be able to get the COVID-19 test done, different locations that they were able to reach them. It's just, that has made a difference to be able to reach more people than we could have initially because of the pandemic.
You know, I think that this pandemic, because it has occurred in such a short period of time and in such a public way, it has dispelled a lot of misconceptions that have existed for many, many years. What I would call excuses that people have used to try to explain the disparities that we see. A lot of those were thought to be biological, right? African Americans are just more prone to these diseases and so on. But you know, what coronavirus has shown us is that, first of all, it's not just African Americans. It's Latino Americans who come from or all over, okay? And it's American Indians who have a very different genetic background, all right? And yet, those communities, just like with all the other things, the diabetes, the hypertension, et cetera, coronavirus, which is an infectious disease, right? And likewise, the distribution of the treatment. The same thing. You know, the well child visits, control your diabetes and so on. Why is it worse in these communities? And all these excuses, I'll just say, I think are excuses, ways to try to explain a very difficult reality. All right. And now we see the same thing with the administration of the vaccine. The same communities are being adversely affected. So I hope that it will open our eyes and give us the courage and the initiative to deal with the problem rather than try to explain it away.
All right. That will be all we have for today. I want to thank each of our panelists for their participation. If you submitted a question that we didn't get to, don't worry. We'll make sure the panelists get back to you with a response within the next few days. Thank you so much for joining us, and have a great day.
Everyone.